Welcome back to Heal and Learn. We're going to do a quick example of how to build the meridian truss of Tai Yin and Tai Yang and why you'd select that. So remember, Tai Yin is all about nutritive qi and dampness being spread throughout the body, while Tai Yang is about separating clear from turbid and maintaining fluids. So that maintaining fluids is going to be the middle ground of how Tai Yin and Tai Yang can be working together. We are able to connect these two not only through their functions, but ultimately it has to match one of the 5 systems, and we're focused on system number 1, which is the same name within the branching. So Tai Yin versus Tai Yang. So that Tai is going to be the root, and we're just going to be branching Yin versus Yang. Remember, in your steps when you build a truss, it needs to just be a square, and it's going to be a little box, a little crosshair. And so in the upper boxes, those need to be your hands, and the lower boxes, those need to be your feet organs. It will trip you up at some point when you kind of like just start losing the basics, so just remember that. And so after that, remember we have 4 options of how our truss can look. It can either be a hourglass, a sideways hourglass, a box, or a box with also an hourglass in the center. The box with the hourglass in the center would be the most balanced, but there's really only one way to do that. Everything else is going to be one of the other options. So now what we're going to do is, once we have our meridians placed out, so let me just do this with you. Looking at this, I drew my little picture of my person. On my yin, I have my lung, and my yang is small intestine, and it's alternating yin, yang. So you can see that's placed. The next step is going to be placing the bagua lines of each meridian. So remember, I gave you this cheat sheet, but ultimately it's just 3 lines per organ, and you just double it to get 6 lines, because the 6 lines are going to be equivalent to the antique chart on the big picture. Plus, we're either going to be using the low or the source point within all of that. So with the meridian conversion, you can either go up and down, so UB to lung, or you can go side to side, so lung to small intestine. You cannot do a meridian conversion on one side up and down and then the other side to side. It either needs to be horizontal or it needs to be vertical. It cannot be both. And it cannot be diagonal either. So looking at lung to UB, and again we're counting from the bottom and then we're counting up. The differences on line 1, those are not the same, so we have to do a needle at line 1 to help convert those. And then we go up to line 4, and then those are not aligned, so we would have to do line 1 and line 4. How we would mark that in our studying notes is as Roman numerals. So it's going to be a Roman numeral 1 and then a Roman numeral 4. We are starting to have like lots of different numbers here. So I numbered my lines. I am now doing Roman numerals, because if I just have 1 and 4, does that mean I'm needling lung 1, lung 4, UB1, UB4? It gets very confusing too quickly. So Roman numerals will be used to differentiate between your meridian conversions. So that's if we go up and down. If we were to go side to side, so let's just look at lung and small intestine, we could go line 1 is the same, line 2 is different, so we could do a 2, 3 is the same, 4 is the same, 5 is different, a conversion of 2 and then 5. We either have a 1-4 going up and down, and then we have a 2-4 going side to side. That is going to stay true if we did the other side. So let's just go down to UB, and then let's connect UB to spleen. When we go side to side up top, it was a 2-5, and if we go side to side on the bottom, it is also a 2-5 meridian conversion. And then same thing if we go spleen to small intestine, up and down on the lung and UB, we're 1 and 4. And now if we go to spleen 1 and small intestine, it would also be a 1 and then 4. So that is why It is important to get a truss that is balanced because, first of all, it's balanced between yin and yang, it's balanced behind feet and or hands and feet, and now it's also balanced in the placement of the needles. That is a true truss right there. So in this, what's going to be important is we can now look at the point energetics, and do we want to be using points 1 and 4? That's our Jingwell and then our source points. So maybe we're trying to clear excess heat, maybe we just need overall balance, or we could do systems 2 and 5. System 2 or meridian conversion 2 and 5, that would be our yin springs and then our rivers. So maybe we're needing to clear deficient heat, and that would help balance that out more. We could also go based off of imaging. So thinking about where small intestine 2 is, do we have more of upper neck pain or are we having lower neck pain? It just really depends on everything that you're trying to work on. SI3 is also great for the nipple. So are we going more neck, more nipple, and chest? What are we trying to do? And so you can start to think about all of the points and what the best treatment would be. And so now that we have the meridian conversions, we could map this out to choose the points itself. So then once you do the meridian conversion and it's mapped out, you're now ready for needling. And so you're really going to choose between 1 and 4 or 2 and 5. And that's also going to be another rhythm that you'll see is since all of the bagwas are just repeated twice, 1 and 4 will always be matched, 2 and 5 will always be matched, and then 3 and 6 will always be matched. And so just knowing that will also be a leg up to help you understand if you're getting like a 1 and 3 conversion, that's not right. Like you got to double check. Did you draw the bagua right? Did you just look at it right? You got to double check. So now that you're ready to needle, it does not matter which side you're needling on and how you do it and what order you do it per se. All that matters is that, again, on the quadrants of the body, you're continuing the yin and yang, and that's the only needle you are needling on that meridian. So let's say I'm choosing the 1 and the 4, and I'm choosing lung 8 and lung 11. I cannot do any other lung point on that meridian. I also, if I wanted to do this balance and I'm wanting to add more points in for something else that's going on, I cannot do any of those other meridians, and I need to stick with the flow of yin and yang. So let's say I want to add in stomach 36, I have to do that on the UB yang leg, and that's how it has to be for any of the meridians. So if I want a hand yin, it has to be matching the quadrant of the hand that is yin, and that's how you'll continue the flow. I think that's it. I mean, we're just gonna keep kind of doing practices and examples as we go. So again, this is a balance between Tai Yin, Tai Yang, and this flows because it is the branching name through system 1, and it is regulating dampness and balancing fluids, and it works on many things, especially great for skin conditions, asthma potentially, and bladder problems. Anything where the fluids are, this would be a fantastic reason to be doing it. Okay, keep following along.